the biggest challenge of all that disabled people face in London is finding suitable housing, accessible housing that meets our needs. But also finding homes that people can afford. So these are the two biggest challenges that people face. Some people have to wait years, sometimes decades, for suitable homes, particularly in the social rented sector. And that's because there aren't just enough accessible homes being built. And also we know that most of the existing housing stock is not accessible and can be adapted to meet disabled people's needs. We've spoken to people who live their life in one room. They wash, they eat, they sleep in one room because the other rooms are not accessible. People who can shower or cook independently without relying on carers or partners, right? That's the reality that a lot of people face because their bathrooms and kitchens are not accessible. Inaccessible housing doesn't just have a huge negative impact on people's physical health. It does take a huge toll on people's mental health. The amount of people we spoke to that experience stress, anxiety, depression, that had to be hospitalized, it's just outrageous. The last thing I wanted to add is that we don't have to forget that living in inaccessible and affordable homes doesn't just have a negative impact on disabled people. It has an impact on wider society. There are plenty of studies that show that inaccessible housing is linked with poor employment outcomes. Literally, the Equality and Human Rights Commission said this a few years ago. Inaccessible housing, living in inaccessible housing means that disabled people are 4 times less likely to be in employment. And if I can add as well, a lot of people are more relying on social care because if the homes was accessible, they could live more independently. They wouldn't have to rely that much on social care. And they are hospitalized even more, right? And so if we're also keen to reduce hospitalizations, we need to invest in accessible housing and make sure that people can be discharged from hospital, because a lot of people can actually be discharged from hospital, not because they are too unwell, but because they have completely unsafe homes to return to that they don't get discharged. So just wanting to give a wider picture and say that accessible housing is not just for disabled people, it's for everybody, because everybody is going to get old at some point in their life, and we've got an aging population. So failing disabled people means failing society overall. I just wanted to add this. So we really need to make sure that we tackle this crisis for the benefits of everybody. We know that there is a shortage of accessible housing across all housing tenures, but specifically the shortage is acute in the social rented sector, especially when it comes to wheelchair accessible homes. So from our perspective, what we really would like, the mayor and the GLA to do is definitely boost the supply of accessible homes, particularly in the social rented sector. And we want to see more new build accessible homes, but also we want to make the most of the existing housing stock and try to see whether we can retrofit as much as possible existing homes to the highest possible accessibility standards. So we know that most councils actually don't know about disabled people housing needs. They don't know how many accessible homes they are building, what level of accessibility these homes have been built to, and also they don't know how many accessible homes are actually affordable. So they don't have granularity of data, for example, about whether counts, for example, an accessible home is in social rent or is London living rent or shared ownership or even rent, market rent or for sale. We don't know, for example, how many homes are visitable and built to M41, M42 and M43 homes, whether the existing housing stock can be retrofitted to meet disabled. What we would like to see is for the GLA to monitor accessible housing starts and completion by tenure, because as we were already saying earlier, we really need to monitor where these accessible homes are built, what kind of tenure, and we believe that housing providers, registered housing providers, should be required to collect data on the accessibility level of the homes that they are building under the Affordable Homes Programme, for example, because they are required to build homes to accessibility standards. We are actually quite concerned that the accessible housing targets in the London plan are not being met by all boroughs. And what we have been saying, we would really like the mayor to investigate why the accessible housing targets are so low. Just to give an idea, we've got 3% of approvals for accessible and adaptable homes instead of 90%, and less than 1% of approvals for wheelchair user homes, when we should have 10%. And what we've been asking the mayor is to set up a task force, which should be chaired by Deputy Mayors of Planning and Housing, and should be made up by local authorities and also deaf and disabled people organisation. And what they should do is to investigate the reasons behind the lack of compliance with the targets. There are quite a few local authorities who don't have a very good understanding of inclusive housing design and accessible housing standards. And we know that most local authorities in their local plans are not making plans for how many accessible homes need to be affordable. So we think that the mayor should actually take the lead in that respect. And if I can add, currently, the 10% targets for the delivery of wheelchair user homes applies across 10 years. What that means is that you can build this kind of 10% across different tenures. You can build them for sale, you can build them for market rent, you can build them for affordable products that we know that is not just social housing. You can also build them for like intermediate products, as Suzanne and Hayley were saying, right? At the moment, there is no guarantee that we're going to have wheelchair user homes specifically in the social rented sector because the 10% applies across all tenures. And actually what we've seen throughout our research is that developers end up building accessible homes, specifically wheelchair accessible homes, in more expensive tenures, but then they can't find people, of course, to buy these homes because they're too expensive.
Are you content with the way in which you're currently consulted with by the GLA?
Okay, so the short answer to your question is that we are not really meaningfully consulted by the GLA on accessible housing. So for us, some of this kind of engagement or consultation, whatever we want to call them, it feels quite tokenistic to us. It feels a bit a tick box exercise. Also, speaking of consultation needs to be accessible. If you want to hear from disabled people, you need to make sure they are accessible. Just to make an example, the Towards a New London Plan consultation wasn't accessible. There were no alternative formats available, no easy read, no BSL version, no large print. How do you expect people to understand what your policy proposals are and respond?
That's actually quite shocking, isn't it?
Yeah,
and it's actually quite shocking that the London Plan consultation wasn't accessible to all Londoners.
Yeah, we want co-production. We don't want consultation, Especially we don't want consultation after the decision has been made.